Imagine waking up one day, feeling more tired than usual, your vision a bit blurry, and you've noticed your skin isn't quite what it used to be. These subtle changes might not seem alarming, but they could be your body's way of telling you something important. Diabetes is a silent condition that can sneak up on you, especially if you're a woman over 50. Today, we are going to uncover the signs of diabetes that every woman in this age group should be aware of. It's not just about numbers or blood tests, it's about recognizing the early warning signals that your body sends out, so you can take action before it's too late. Understanding diabetes and its impact on women over 50. Diabetes, particularly type 2, is a condition where your body either resists the effects of insulin or doesn't produce enough to maintain normal glucose levels. As we age, our risk of developing diabetes increases, especially for women over 50. This is due to various factors like hormonal changes, a slower metabolism, and increased insulin resistance. For women in this age group, diabetes can be particularly dangerous because it often goes undetected until it has already caused significant health issues. Knowing the signs and symptoms can make all the difference in catching it early and managing it effectively. The different types of diabetes. Before we dive deeper into the symptoms, it's important to understand the different types of diabetes that can affect women over 50. The two main types are type 1 and type 2 diabetes, but there's also gestational diabetes, which occurs during pregnancy, and a growing concern known as type 3C diabetes, which is related to pancreatic conditions. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks the insulin-producing cells in the pancreas. This type of diabetes is less common and typically diagnosed in younger individuals, but it can still occur in older adults. For women over 50, type 1 diabetes may present with similar symptoms as type 2 but requires different management, including insulin therapy from the outset. Type 2 diabetes. Type 2 diabetes is by far the most common form, especially in older adults. It develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin. This form of diabetes is closely linked to lifestyle factors such as diet, physical activity, and body weight. However, genetics and hormonal changes, particularly around menopause, can also play a significant role. Gestational diabetes. While gestational diabetes typically resolves after pregnancy, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. For women over 50, this risk is particularly relevant, and it's crucial to monitor blood sugar levels regularly if you had gestational diabetes in the past. Type 3C diabetes. Type 3C diabetes is a less well-known type that occurs when the pancreas is damaged by conditions such as pancreatitis, pancreatic surgery, or cystic fibrosis. It's often misdiagnosed as type 2 diabetes, but it requires different treatment. Understanding the differences between these types is vital for proper diagnosis and management. How menopause affects diabetes risk. For women over 50, menopause is a significant factor that can influence the development of diabetes. During menopause, the body undergoes hormonal changes, including a decrease in estrogen levels. Estrogen plays a key role in how the body responds to insulin, and lower levels can lead to increased insulin resistance, a precursor to type 2 diabetes. In addition, the symptoms of menopause, such as weight gain, especially around the abdomen, and changes in blood pressure, can further increase the risk of developing diabetes. It's also important to note that some symptoms of menopause, like fatigue, mood swings, and difficulty concentrating, can overlap with symptoms of diabetes, making it challenging to distinguish between the two without proper medical testing. The role of hormones in diabetes development. Beyond menopause, other hormonal imbalances can also contribute to the risk of diabetes in women over 50. For example, thyroid disorders are common in older women and can affect metabolism, weight, and energy levels, all of which are related to diabetes risk. Moreover, conditions like polycystic ovary syndrome, PCOS, which is linked to insulin resistance, can persist or even worsen after menopause, further increasing the likelihood of developing type 2 diabetes. Understanding the interplay between hormones and diabetes is crucial for women in this age group. Early warning signs of diabetes in women over 50. Now, let's dive into the specific signs that might indicate the onset of diabetes in women over 50. These symptoms can be subtle, but they're crucial to recognize. Fatigue and increased thirst. One of the first signs of diabetes is a persistent feeling of fatigue. You might find yourself feeling unusually tired, even after a full night's sleep. Alongside this, increased thirst, known as polydipsia, is another early warning sign. If you find yourself constantly needing water, more than what feels normal, it's worth paying attention to. Frequent urination. Another key symptom is frequent urination, especially at night. This happens because your kidneys are working overtime to filter out the excess glucose from your blood. If you're getting up multiple times during the night to use the bathroom, this could be a red flag. Unexpected weight changes. Sudden and unexplained weight loss or gain is another symptom to watch for. In the early stages of diabetes, you might lose weight without trying, as your body starts breaking down muscle and fat for energy instead of using glucose. On the flip side, some women might experience weight gain, especially around the abdomen, due to insulin resistance. Blurry vision. Blurry vision is another common symptom that can often be overlooked, especially as we age and attribute it to normal changes in eyesight. However, in the context of diabetes, elevated blood sugar levels can cause the lens of your eye to swell, leading to blurred vision. If you notice your vision suddenly becoming less sharp or if you experience difficulty focusing, it's important to consider that this could be more than just an aging eye. It could be a sign of diabetes. Slow healing sores. When your body struggles to heal itself, it's a significant signal that something might be wrong. High blood sugar levels can affect your blood flow and slow down your body's natural healing processes. You might notice that cuts or sores, especially on your feet, take much longer to heal than they used to. This isn't just an inconvenience, it's a critical sign that your blood vessels are being damaged by elevated glucose levels, which can lead to more severe complications if left unchecked. Skin changes. Changes in your skin can also be an early indicator of diabetes. You might develop dark patches of skin, particularly in the creases of your neck, armpits, or groin. This condition, known as acanthosis nigricans, is a sign of insulin resistance, which often precedes the development of type 2 diabetes. Additionally, you might notice other skin conditions, such as increased dryness, itchiness, or a tendency to develop infections. These changes are often the result of high blood sugar levels and decreased circulation. Numbness or tingling in hands and feet. One of the more serious signs of diabetes is neuropathy, which is nerve damage caused by prolonged high blood sugar levels. This often manifests as a tingling or numbness in your hands and feet, which can progress to pain or a burning sensation over time. If you're experiencing these symptoms, it's essential to seek medical advice as soon as possible, as this could indicate significant nerve damage. Increased risk of infections. Diabetes can also weaken your immune system, making you more susceptible to infections. Women over 50 might notice an increase in urinary tract infections, yeast infections, or even gum infections. These recurring infections are often a sign that your body is struggling to manage blood sugar levels, which creates an environment where bacteria and fungi can thrive more easily. Psychological symptoms linked to diabetes. While we've covered the physical signs of diabetes, it's also important to acknowledge the psychological symptoms that can accompany this condition. Women over 50 are often at a stage in life where they might be dealing with multiple stressors, such as retirement, caring for aging parents, or coping with the loss of a spouse. These stresses can contribute to the development or worsening of diabetes symptoms. Depression and anxiety are common in individuals with diabetes, and these conditions can create a vicious cycle. High blood sugar levels can lead to mood swings, irritability, and difficulty concentrating, while the stress of managing a chronic condition like diabetes can exacerbate mental health issues. If you're experiencing symptoms of depression or anxiety alongside the physical signs we've discussed, it's essential to seek help from a healthcare provider who can address both aspects of your health. The impact of diabetes on cardiovascular health. Diabetes doesn't just affect your blood sugar levels, it has far-reaching consequences for your overall health, particularly your cardiovascular system. Women over 50 with diabetes are at a higher risk of developing heart disease, stroke, and high blood pressure. High blood sugar levels can damage the blood vessels and nerves that control your heart. This damage increases your risk of developing conditions like coronary artery disease and heart failure. It's important to be aware of the signs of heart disease, which can sometimes be different in women than in men. These signs include chest pain, shortness of breath, and fatigue. If you have diabetes, managing your heart health is just as crucial as managing your blood sugar levels. Importance of regular screening. Given the subtle nature of some diabetes symptoms, regular screening is essential, especially if you're over 50. Annual checkups with your healthcare provider should include blood tests that measure your fasting glucose levels, HbA1c, a measure of your average blood sugar over the past 3 months, and your cholesterol levels. These tests can help detect diabetes in its early stages before symptoms become severe. If you have a family history of diabetes, a history of gestational diabetes, or other risk factors like obesity or high blood pressure, it's even more crucial to get screened regularly. Early detection is key to managing diabetes and preventing complications. Managing diabetes through lifestyle changes. If you've been diagnosed with diabetes or are at risk of developing it, making lifestyle changes is one of the most effective ways to manage the condition and prevent complications. Here's how. Dietary changes. Eating a balanced diet is key to managing diabetes. Focus on incorporating whole foods like vegetables, fruits, lean proteins, and whole grains into your meals. Avoiding processed foods, sugary drinks, and high-fat foods can help keep your blood sugar levels stable. It's also important to monitor your carbohydrate intake, as carbohydrates have the most significant impact on blood sugar. One helpful strategy is the plate method, which involves filling half your plate with non-starchy vegetables, a quarter with lean protein, and the remaining quarter with whole grains or starchy vegetables. This simple visual guide can help you manage portion sizes and ensure you're getting a balanced meal. Physical activity. Regular physical activity helps improve insulin sensitivity, lower blood sugar levels, and maintain a healthy weight. Aim for at least 150 minutes of moderate exercise per week, such as brisk walking, swimming, or cycling. Strength training exercises are also beneficial for building muscle, which can help your body use insulin more effectively. If you're new to exercise, start slowly and gradually increase the intensity and duration of your workouts. Even activities like gardening, dancing, or taking the stairs instead of the elevator can make a big difference in managing your diabetes. Stress management. Managing stress is an often overlooked but crucial aspect of diabetes care. High stress levels can raise your blood sugar and make it harder to manage your condition. Incorporating stress-reducing activities into your routine, such as yoga, meditation, or deep breathing exercises, can help you maintain better control over your diabetes. Mindfulness practices, like focusing on your breath or being present in the moment, can also help reduce stress and improve your overall well-being. Finding hobbies that you enjoy and spending time with loved ones can also provide emotional support and reduce stress. Regular monitoring and medications. Regularly monitoring your blood sugar levels is essential for managing diabetes. Depending on your condition, your healthcare provider may also prescribe medications or insulin therapy to help control your blood sugar. It's important to follow your treatment plan closely and keep regular appointments with your healthcare team to monitor your progress. Support systems and resources. Living with diabetes can be challenging, but you don't have to go through it alone. There are many resources available to help you manage your condition. Support groups, both online and in person, can provide a sense of community and help you connect with others who are facing similar challenges. In addition, there are numerous educational resources available, such as diabetes education programs, which can help you learn more about managing your condition and making healthy lifestyle choices. Your healthcare provider can also refer you to a dietitian, a diabetes educator, or a mental health professional if you need additional support. When to seek medical advice. If you're experiencing any of the symptoms we've discussed today, or if you're concerned about your risk of developing diabetes, it's important to seek medical advice as soon as possible. Early diagnosis and treatment can prevent complications and improve your quality of life. Your healthcare provider can perform tests to determine whether you have diabetes or are at risk of developing it. They can also provide you with personalized advice on how to manage your condition and prevent complications. Final words. Understanding the signs of diabetes is the first step toward taking control of your health. For women over 50, the risk of developing diabetes is real, but with the right knowledge and tools, it's a condition that can be managed effectively. Remember, your health is in your hands, and recognizing these early warning signs can make all the difference. Thank you for watching. If you found this video helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more health-related content.